welcome to the Premature Week. I'm Fabiana, Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. If you are joining us here right now, welcome. And if you are logging back, I'm very happy to see you again. And the Premature Week is the second of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANS, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside an ICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. I'd like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Premature Week. And right now, we are going to talk about World Prematurity Day that we are celebrating today, and a very important campaign, Zero Separation, created by GLANS. World Prematurity Day on November 17th is one of the most important days in the year to raise awareness of the challenges and burden of preterm birth globally. The day was initiated by EFCNI and partnering European parent organizations in 2008. This year, World Prematurity Day will be in the midst of the pandemic. Since the outbreak of COVID-19, neonatal units have adopted a separation policy limiting or prohibiting access of parents to neonatal care units. In partnership with other parent organizations, EFCNI launched the international campaign Zero Separation. Together for better care, keep preterm and sick babies close to their parents. And to talk about this, I have Silke, who is the chairwoman of the executive board and co-founder of EFCNI. In 1997, her twins were born at 25 weeks gestation, and Silke and her family did not receive enough information and support that she needed. Unfortunately, one of them died a few days after birth. During her time in hospital and afterwards, Silke was faced with the non-existence of support of any kind, the absence of public awareness, and the lack of information and education for parents during pregnancy. Her motivation is to prevent parents from having similar experience in such painful situations. As the conditions throughout Europe are distressingly similar, and preterm children urgently need a voice within Europe and worldwide, she decided to take on the role of the chair of the executive board of EFCNI. Silke has won numerous awards in Europe and worldwide, and I have here with me today Silke. Thank you so much for joining us from Munich, Germany. I know it's 6:30 in your time there, and your monuments are already lit up in purple. Thank you so much for joining us here today and to share the amazing work you've been doing around the world to change prematurity. So thank you.
Yeah, thank you for inviting me to give an overview on the Zero Separation campaign, just coming from another webinar from WHO to just share the patient's point of view. It's my pleasure also to share with you the presentation. I hope you can see it in the meanwhile.
Okay, let me okay, there you go. Now you can make a full slide.
So can you see it now?
Yes, that's wonderful.
Yeah, so World Prematurity Day, as you have mentioned, Fabiana, is this year under the umbrella of the COVID-19 pandemic. And therefore, it's important to put also this into account when we talk about World Prematurity Day. And preterm birth complications are the leading cause of death among children under 5 years of age. And when we see the map of the world where babies are born preterm, we see also that in a lot of low and middle income countries, the majority of our babies are born preterm. Nevertheless, in our country, like yours in Canada or myself in Germany, or even also in high income countries, you see a lot of colors where you see the amount of babies born preterm. And so also the majority of our babies born preterm suffer finally lifelong. Not all of them, of course, from severe disabilities, but nevertheless, the majority of these children born preterm suffer lifelong from different kind of diseases at the end of the day. What we have done, founding GLANCE, was the initiative, because as we founded EFCNI, so the European organization, we had at this time, of course, not the idea to really have a global initiative, and being only 3 people having an idea without having money, we had, of course, already a big challenge in front of us all over Europe. But when I was invited more and more to World Health Organization meetings, UNICEF or UN meetings, where they talked about the prematurity issue on a global level, we thought it is really time that we, from the rich countries of the world, try our best to speak up for the majority of the babies born preterm in low and middle income countries. Therefore, in 2019, and also Fabiana has joined us here, we founded GLANCE, the Global Alliance for Newborn Care. And at this event already, and at this first call to action, we had already a zero separation policy asked for. So we have asked all the 170 organizations who celebrated with us World Prematurity Day every year. And so we asked them to join us with all these demands and questions we have for the community. At this time, it was last year, World Prematurity Day, where we founded GLANCE, nobody thought on a pandemic like this we have at the moment. And when we talk about the family integration or the family-centered care approach, we have at the moment, even in the high-income countries where I'm coming from, and also you from Canada, we have different aspects of how our children are treated. And the one aspect is that we really have a family integrated care system, but also look for the development of the brain of this child, but also for long-term development. And how does this look like? And you have, of course, then to provide a 24/7 welcoming policy. You have to provide a bed. You have to take care of this tiny little baby and the family. That's the ideal world, what we have asked. Yes, now we have the pandemic situation, and the majority of the NICUs are empty. Only staff members are there, parents are separated from their baby, but we know that this will have a consequence lifelong of the health of our baby. So therefore, how can we really change the situation again to a more welcoming policy? So the pandemic really came suddenly. So that means our parents, when they were in the situation, and the parent representatives, there were a lot of questions they have asked us. So we have now the situation all over the world that parents are separated in some regions of the world because they have no incubators. Parents and babies can stay, of course, together. On the other hand, they have not really hygiene measures. We have still the situation, as I mentioned before, where parents and babies can stay together. But we know from March on worldwide that the neonatal units have adopted their separation policy really tremendously. We know also that they have changed even the standard of care. So that means they have even changed their policy of how they do a cord clamping, how they resuscitate. In some countries, they really changed even that kind of policies without having any kind of evidence behind. First, we wanted to help the parent organizations and the parents, that we really provide questions and answers where parents have actually in this situation. When you are pregnant and you don't know, can my partner be with me? Where can I deliver? What happens when I have the coronavirus? What happens then? Can I have midwifery support? Can I deliver in the hospital I have planned? We have also the situation that there were many, many questions around birth. Can I breastfeed, for example? Again, can my partner be with me? Where can I deliver? Is my delivery still safe? When the baby ends up in the NICU, what kind of welcoming policies or visiting hours they have. And I don't like, as many of you know, I don't like the word visiting, because we are not visitors. We are the parents of this child, and therefore we are no visitors. But when it comes to discharge and to follow up, how is this organized? Can I really have a physiotherapy after discharge? Is this possible? And just when you imagine that the majority of these parents were overwhelmed with the situation, as well as the healthcare professionals, but when you imagine you cannot provide physiotherapy or follow-up for these children, what does this mean for the health of their baby? And that was what was coming up to us as EFCNI in Glance, and we had to immediately act and provide this kind of answers for all the questions we got. Another tool we have done for Glance is we wanted to really know the patients and parents' perspective. So we have set up a scientific research project, a survey where we asked in 27 languages our parents all over the world how the situation really is in the neonatal units. Are there really welcoming policies or visiting hours or any kind of restrictions? And if yes, how much are they going? In some countries, we have heard that they even not have any kind of contact and access to their babies. We have heard that breastfeeding is not possible, milk cannot be provided, and we all know how challenging this is from a long-term perspective when we cannot provide mother's own milk to our very tiny babies. So therefore, we have developed this online multilingual survey, which will end of November. So please, if you are willing to join this survey, it is important to give us feedback, because we really want to show what has the impact, what kind of impact has this pandemic on the parents born preterm. So please support us and join us when you are a parent born, when you are a parent of a preemie baby, which is in the time frame of the pandemic in the neonatal units. And now we would come to the Glance zero separation campaign. This whole concept really has to be understood as one real project, because we cannot separate the frequently asked questions with the survey and this campaign. It really is one whole program we would like to roll out. And what we have heard from our parents, for example, is that we have a really lack of information on the one hand, but also a lack of support for parents. Therefore, we wanted to show evidence that it is important to have a zero separation policy. One of the aspects was breastfeeding and human milk donation. The World Health Organization has clearly recommended that breastfeeding is key. It should be continued. It should be continued to donate milk, that the babies born preterm really get the best care they can have. We have heard that lung diseases, or the people are scared about potential lung diseases premature babies can have, like at the moment the RSV infection. We know that this is a very severe disease and can happen or can affect our children, but we focus mainly at the moment on the coronavirus and potentially forget to immunize our children on RSV. We have a lot of babies born preterm who are now children, teenagers, and young adults. These children and these young adults have a higher risk to get a severe development of the coronavirus. So that means if they get an infection, they have a much more higher risk to get a severe development of it. The mental health aspects, you just can imagine when you not be able to see your baby, touch your baby, and even not at all, because some of the NICUs close their doors totally, what kind of consequences it has for the babies, but also for the family. And so therefore, we want to take into account and want to spread the message about this aspect. We want to talk about the discharge and going home situation. As mentioned before, that is one of the key aspects we have to think about when these babies in the time of the pandemic go home. Is there any kind of risk factors for the development when you not can really have appointments with your physiotherapist, with your pediatrician, with your occupational therapist? What kind of challenges we face here? And we should not forget the fathers and other family members, partners who are not able potentially to see their child or see their grandchild. What does it make for them? And in this case, when we started in July this year to coordinate in the end the zero separation campaign, 120 organizations signed up. But you all know signing up means not honestly really to support it and implement or help us to implement this strategy into the level of a national level, of a local level, or even to speak up, to convince other colleagues and partners to realize in the end a zero separation policy. But how is the situation really when we see it all over the world, or even in each of the different countries? We have really several hospitals all over the world. They allow not at all any contact to the parents. That means they provide potentially videos or photos of the baby, but they have no contact to their baby until the baby is discharged. And knowing this from my own, I was 4.5 months with Lucas in the hospital. That is really not only a challenge, that's a disaster. In several countries, for example, in Ireland, we had or also in Greece, we had the situation what we know that 5 up to 15 minutes per day or even only per week were allowed. Our colleague Mandy Daly from the Irish Parent Organization have even set up a campaign that 15 minutes are not enough. And so therefore, that is really not only a small group of hospitals who are providing this, this is really a huge group of hospitals who only provide 15 minutes more or less per day or per week. In several hospitals, and I know this is also the case in Canada, you are allowing only one parent per day to visit or see your baby. That means that mainly the fathers are not able to see their child. I can tell you from my own experience, my husband had a severe depression years after Lucas came home because he was often not able to see his son Lucas, and only was allowed on Father's Day, so 3.5 months later as Lucas was born, the first time in his life to kangaroo him. And that made a difference in his health. It made a difference in how he could cope with this situation. And therefore, I really ask you to think about that you welcome parents both. It's not only the mother who is a parent, it's also the father. And we have the difference of no change. And I'm very proud to say this, and I have not believed it really, that Germany is one of these countries who is welcoming parents for 24/7. All over Germany, there we not really have any excuses. Maybe in some areas where we not have both together, but each of the parents can come 24/7. We have not everywhere facilities where we have a bed, but the parents have no limitation to come. And I guess the reason why we have this here in Germany is that we've worked for more than 20 years for this 24/7 welcoming policy. And only Sweden, we know, and Germany have this kind of no change policy all over the world. What does it mean? Separation is harmful for the baby and the parents. And we know from the evidence what it means. That means that we not can really provide an exclusive breastfeeding for this baby. How can breastfeeding work when you separate the baby from the parents? We know that the mother's own milk is really key in the health outcome of a baby. And when you put so much pressure and stress on the shoulders of parents, how should the milk flow and how should it work in the end that the mother can provide really mother's own milk in the same way as it would be with the baby together? And when you see here the facts and figures that we would decrease the risk of necrotizing enterocolitis, sepsis, or infant mortality by 50%, then I would ask you why you are still working on a separation policy when we, especially in the rich countries, can provide hygiene measurements, can educate and train our parents, and can provide in the end access to our babies. We know that there is also a better mental outcome, not only for the babies, also for the parents. Another key aspect what I would like to share with you is the aspect of the kangaroo mother care or skin-to-skin care. What is not possible when you have a policy like 15 minutes, you can't kangaroo there. Even if you only allow one parent to come, how can the father start to become get a really bonding between both? And when you see also here the key facts and figures, it would reduce the mortality by 40%. Even infection, and we talk about corona as an infection, even infection and sepsis decreases on 65%, hypothermia on 72%. And this shows also what the parents or the parents as main caregiver can be supportive for a neonatal unit. The nurses, we know at the moment that there is a lack of nurses and doctors in the hospitals. So that means having not enough nurses, having not enough doctors, you have not enough time potentially to wash your hands, to go patient by patient, and can in the end even increase the infection and the sepsis rate. Therefore, if the parents are well educated and well trained of how to take care of not bringing the virus into the NICU, and you provide hygiene measurements, you can welcome parents 24/7. And we know that the mental health aspects of kangaroo mother care or skin-to-skin care is key, and therefore it has a long-term consequences even after 10 years of life. When it comes to the separation between the bonding aspects, parents welcome in the end the parents, we know that the language outcome is better when parents and babies can be together. We know that the weight gain is better. We support, of course, the exclusive breastfeeding, as I said before, and we would decrease the stress and the anxiety of parents. And we have to take into account it is not only the baby as a patient, it is the whole family. And this baby belongs to the parents. It's not the ownership of the hospital. It is the ownership of the parents. And how can we ensure to really bring these people together and in the end to improve the care or improve the care and the outcome of our children. So when you see here these figures and also the facts, we ask always, or you have asked us always, on evidence-based medicine. And this is evidence-based medicine to provide kangaroo mother care, to provide a zero separation policy, and to provide breastfeeding. And that are the key aspects of why a zero separation policy needs to be implemented. If you not have it at the moment, you have to rethink about your strategy. What can you do? And we have, of course, a lot of collaboration partners in the meanwhile, healthcare professionals, the World Health Organization, nurses are joining us. But I also want to share with you the last quote, what we have got here from our French partners and friends, SOS Premature, who have shown here in their quote that all the years of hard work, what they have done with the multiple stakeholders all over, the interdisciplinary teams, all the work we have done to have a zero separation policy, to have a welcoming strategy, to have a family integrated care policy seems to be damaged at the moment because of, no facts and figures why we are doing this, but we separate our babies from the parents. So please rethink your strategy, talk and convince in the end your colleagues or your administration to rethink why you are separating the baby from the families. And I would like to close my presentation with these really emotional pictures. One, you see a mom where she is showing a picture into the camera because she has not the opportunity to see her baby, not to touch her baby. And you just have to look into her eyes and the pain she feels and how sad she is. And you see the picture next where the couple with the masks are bathing their baby. Seems to be maybe the first time because you can see in the eyes how emotional it is for them. And there is not a reason why not be willing and allowing these parents to be parents in the time of the pandemic. And you just can imagine what both parents, the couple and this individual mom, will suffer lifelong or have the opportunity to cope with the situation, getting a baby born preterm in the time frame of the pandemic. Thank you very much for your attention, and I'm happy to answer your questions.
Thank you, Silke. Thank you for your advocacy and for engaging all these organizations and all parents organizations from around the world for the Zero Separation campaign. We only have 5 minutes left, but I really want to ask you, what is the goal of this survey? We have engaged so many countries in this survey. When we spread in this survey, we have shared the link. So what is your goal with that, with the results and the data that we're going to collect?
Yes, what I can share with you is that when we only share emotions, we will not change systems. We will not change in the end or convince healthcare professionals. And even when a next pandemic, hopefully not so soon, but if there comes a next one, or even going back to the old system, that we have a chance to argue what happens late, what happens in the time frame, what really happens. Because when I give talks in the meanwhile, people say, yeah, we are not forbidding the parents to go there, or they say, yeah, it's only for protecting the baby. But if we can show that the majority of the hospitals all over the world have changed their policy, how deep really this change happened in these different countries. Also to compare, like Germany, why Germany, and we have also a high wave at the moment, not stopping in the end the welcoming policy, and why we are doing this, and why, for example, Canada, who is in the, I would say, more or less the same situation of how we handle normally health issues. You are separating even fathers at the moment, or you're not welcoming them 24/7 everywhere all over Canada. And why is this the case? And we cannot argue without data, and we need data to argue also for improvement after the pandemic, preventing the next pandemic, and even go hopefully back faster to the old situation after the pandemic is over, and to show facts and figures. Without, we cannot convince in the end stakeholders on the different levels.
Absolutely. But I'm happy to share with you that many hospitals have changed the policy in Canada and are enabling parents, both parents, into the ICU. Some hospitals is still one parent at a time, not parents together. And we had situations and baby was palliative care and only one parent could be present in that moment. So we still have a lot of work to do. We are not giving up. And I think the result of the survey will be very, very important to share with healthcare professionals. And we know this pandemic is not going to be over the next month. We still have long ways to go. And I'm hoping we have this data to share and prove that parents are essential in the care of their babies right now, still during this second wave that is hitting us very hardly on the northern hemisphere right now. Silke, just to wrap it up, in your opinion, how do you see family-centered care or family-integrated care moving forward after the pandemic?
Well, our hope is honestly that this publication, because we will really plan a medical publication, will help us to argue. We also have a close collaboration at the moment with WHO, so the World Health Organization, and UNICEF, and we work hand in hand together to spread the message to go back quickly to the old stage where we were before. And even for the ones who were before the pandemic already in a more or less separation situation, we hope with all this argumentation and with this facts of not harm at the end, and be supportive for this baby and the family, will help us really to move forward much quicker as we were even before. Nevertheless, we also, of course, hope that we can help all the families in this 1.5 year, I guess we will have finally this pandemic, help these families who now get their babies born preterm in this time frame to cope and support them with all the mental health problems they will have for sure.
Absolutely, Silke, and I'm so grateful to have organizations like yours leading the way to all of us to work together and change the situation worldwide. So thank you so much, and happy World Prematurity Day to you in Germany. And I will see you very soon, Silke. Thank you.
Thank you very much, and have a wonderful World Prematurity Day. Bye.
Bye for now.